Hello, my name is Abigail Cook. Welcome to my pediatric nursing presentation on the topic of seizures for Professor Lilly, University of Charleston, Beckley Campus, Spring Semester 2021. To begin, what is a seizure? A seizure is the burst of uncontrolled electrical activity between the brain cells, also called neurons or nerve cells. This will cause temporary abnormalities in muscle tone or movements such as stiffness, twitching, limpness, behaviors and sensations or states of awareness. Seizures can be caused by head injuries, brain tumors, lead poisoning, maldevelopment of the brain, genetic and infectious illnesses, or fevers. Epilepsy is not contagious. It's not passed down through families, but someone who has a close relative with epilepsy has a slightly higher risk for it than someone with a family that has no history of seizures. What is the pathophysiology of seizures? They are caused by the paroxysmal discharges from groups of neurons, which will then arise as a result of excess excitation or the loss of inhibition. The key unit of neurotransmission is the synapse, and the fundamental components of synapses are ion channels. What are signs or symptoms of a seizure? Jerking movements of arms or legs, stiffness of the body, loss of consciousness, breathing problems or stopping breathing, loss of bowel or bladder control, falling suddenly for no reason, especially when associated with level of consciousness or staring. What are lab tests or diagnostics? To begin, your doctor will perform a neurological exam, which will test behavior, motor abilities, mental function, and other areas to diagnose condition and determine the type of seizure or possibly epilepsy. Your doctor may also order samples to check for any infectious or genetic conditions that may be associated with the seizures. Your doctor may order to have an EEG performed. This is a test that is most commonly used to diagnose epilepsy. During this test, electrodes are attached to your scalp with a paste-like substance or cap. These electrodes will record the electrical activity of your brain. If you do have epilepsy, there is a common result to have changes in your normal brainwave patterns, even when not experiencing a seizure. The doctor might monitor you on video when conducting EEG while you're sleeping or awake. This will record any seizures you might experience. It will also record to help the doctor diagnose the type of seizure or rule out any other conditions. This test could be done in a doctor's office or a hospital. You might also have an ambulatory EEG in which you wear it while you're at home. The EEG continues to record brainwave activity and any seizures that may occur over the course of a few days. A high-density EEG might be ordered. For this EEG, the electrodes are spaced more closely than a regular EEG. They are spaced half a centimeter apart. A CT scan might be performed. It uses X-rays to obtain cross-sectional images of the brain. It can reveal abnormalities in the brain that might be causing the seizures, such as tumors, bleeding, or cyst. An MRI could be performed. It uses powerful magnets and radio waves that will create a detailed image of the brain. It helps to detect lesions or abnormalities in the brain that could be causing the seizures. A functional MRI can also be performed to measure changes in blood flow that can occur when specific parts of the brain are not working. It might be used before surgery to identify exact locations of critical functions like speech and movement in order for surgeons to avoid those places while operating. A positron emission tomography scan could be used to visualize active areas of brain and detect abnormalities. This test uses a small amount of low-dose radioactive material injected into a vein. A single photon emission computerized tomography test is usually used when an MRI or EEG did not pinpoint where in the brain the seizures are originating. It uses a small amount of low-dose radioactive material injected into a vein to create detailed 3D map of blood flow activity in the brain during seizures. Neuropsychological tests may be performed to assess thinking, memory, and speech skill. It helps to determine which areas of the brain are affected. What are management or nursing interventions of seizures? Most doctors will begin treating seizures with epilepsy medication. If medications do not treat the condition, surgery may be proposed. With surgery, the area of the brain causing the seizures will be removed. Other therapies may be used, such as vagus nerve stimulation, which is when doctors implant a device underneath the skin of your chest, similar to a pacemaker. Wires from the stimulator are connected to the vagus nerve in the neck. This battery-powered device sends bursts of energy to the vagus nerve and brain to help reduce seizures. A ketogenic diet, which is low in fats and carbohydrates, can be used to help reduce seizures in some patients. Nursing management includes placing the client on his or her side, checking surroundings to ensure nothing near the patient will harm him, maintaining an open airway with oxygen and suction available, keeping the patient in lowest position in bed with rails up or padded, or having the patient lying on the floor. Do not force the client to lie still, and do not place anything into the mouth. What are complications and outcomes of seizures? Complications may include difficulty learning, breathing in food or saliva into the lungs during the seizure, injury from falls or other issues during seizing, permanent brain damage, or side effects of medications. Most individuals who develop epilepsy have the high likelihood of achieving remission. Most patients successfully discontinue medications. Usually, a seizure does not cause any lasting damage to the brain. However, having many seizures or having seizures that are particularly severe may cause a person to become more forgetful or find it difficult to concentrate. People with epilepsy have an increased risk of developing depression or anxiety. A few people with epilepsy experience psychosis. Some patients may keep having some symptoms after the seizure activity in the brain has ended. This is because some symptoms are after effects of a seizure, such as sleepiness, confusion, certain movements, or being unable to move, and difficulty talking or thinking normally. Reduction in life expectancy can be up to 2 years for people with a diagnosis of idiopathic or cryptogenic epilepsy, and the reduction can be up to 10 years in people with symptomatic epilepsy. Reductions in life expectancy are highest at the time of diagnosis and diminish with time. Thank you for listening to my presentation. I hope that you were able to learn something, and my references will be located at the end of the slideshow.